more specific we try to get with some of our theories about structure, the more we leave out the big global picture. And ultimately, the more broad I think we could be with our understanding of what we're doing, that's where I think it becomes actually more useful to try to like describe things. But we could get more specific if we want to, but we just knowing that like we're on a slippery slope there as we start to try to get more specific, because that's what a patient feels like they need. We're probably getting farther away from the whole truth. You know what I mean? Like we're leaving many things out. So being more broad, and that's why I like to think of movement is the most broad you can be, right? Like when we just talk about movement, and I find that to be quite useful, right? Because we can then fit all of the other structural theories all in there if we're just trying to guide somebody in a certain direction. And if you don't feel like a joint can move, and we understand the underlying anatomy that goes around a joint, and we get a joint moving with maybe specific pressure in that area over time, well, we are just enhancing an overall movement that we're trying to get down the line. But we don't have to say like we're specifically affecting a capsule or we're specifically affecting fascia. We just need to know that like, okay, I'm holding one side of the joint down while I'm trying to get someone to decrease pain enough to move, the other part of the joint in a way that they can't do on their own, right? And we may say that like we can get our hands closer to the actual joint that we're trying to move than any other exercise would be able to, separate out that specific joint. So it's really just a matter of saying like, okay, I want that joint to move, and all of the other structures will be involved in getting that to move better.
Well, it's almost a sort of funny concept to me, because what you're touching on is like the mass understanding, the large scale understanding of science is that science is learning new things, right? Whereas the real scientific process is reducing ignorance, and so it's just the science is about all the stuff we don't know. And so I do think what happens sometimes is if a patient has this experience of a past care provider, saying that, your joint moved such and such degrees, or like in my case, like the chiropractic case, we took the x-ray and your, your spinal angle's at this degrees. And, after 6 months of treatment, we'll get it down to that. And you can almost with measurements and numbers play this game of like, this is very specific and very scientific. Right. Where the ironic thing being, the more we go down this rabbit hole and the more we learn, it becomes about like, okay, well, last week you put 2 plates away. This time you can put 3 plates, it zoomed out. We can't really, there's no point in measuring anything. There's no point in applying the number, but it kind of looks the opposite way.
Yeah. And I think it's like science, using science as marketing, really. And like, but what happens is, like you said, like science gets sort of this idea where it's all numbers, it's all like quantitative things, it's all reducing it down to being as specific as we can, which then just eliminates complexity. But that's not real life, right? Like, so we're, to have a good scientific experiment, you need to reduce variables. And the reality is that pain and human movement has a ton of variables, right? So we need science that, we need those experiments. Let's not even use the word science. Like we need those specific experiments and controlled experiments to be able to answer specific questions. But it doesn't mean that it's real life. And that is what is marketed in many ways, right? Like, so the idea of a structural theory is not science, but it becomes marketed as if it is. And I think, I think that's what you're saying there. And it makes a lot of sense though, where it's like, it seems like that would be the thing that, professionals do. They're like, you could just look at healthcare now and how many of the revered physicians are specialists, right? They just get more specialized on a certain thing and you get paid more money for that. And you're more of an expert for that, but you have to be able to zoom out too. Right? You have to be able to see complexity. You have to be able to see your specialty within complexity. And I think it becomes actually quite a bit harder to do that the more specialized you get.
Yeah.
And so that's where, again, when you're dealing with movement, it's this very broad, complex thing. And we have to be able to stay panned out in what we're doing. But the ironic thing is it ends up looking exactly like the techniques. When we're talking about manual therapy, like the techniques look exactly the same, no matter what your theory is a lot of times. And I think that's important to just, have an understanding, have a base understanding of all those, but you're going to do the same thing anyway. And you'll have maybe a different idea of why you're doing that in the moment.
Right. Yeah. Based on, any number of theories you want to pick out, rewrite from that. Yeah.
Right.
But you're right. It doesn't really change the treatment very much. What it will change is what you are trying to accomplish with that treatment, and that's important for sure to be looking down the road. But yeah, manual therapy, it's all the different explanations we have basically just come down to, working with that patient and feeling what you feel and, moving toward getting them to create that movement. But it's just interesting to me that, the more truly scientific we get, the more philosophical it looks.
Right.
The more, the more life coachy it looks. And again, it's a little bit something we talked about last time, with back pain and the non-specific nature of it. But yeah, absolutely.
Yeah. Yeah. So I think it's a good discussion to like what you were bringing up before about how you got to listen to the patient, right? And I was just listening to a good podcast about this where, we can really think about like with the totality of the evidence about pain and how non-specific it is, especially with like things like back pain, where like there isn't really definitive diagnoses that are often utilized or at least are useful to make change to low back pain. So we have to really look at everything as patient-centered. So every time somebody comes in, if we don't listen to them and we just have our idea of like what we're going to do because we've done it with somebody else, we're really missing the boat, right? Like, so it's really just, we have to adapt to what the patient says. And that means that we have to have a more flexible and fluid way of describing things, right? So that to me just builds on like that builds on how you want to look at your experience as a clinician, right? So if you get whatever you get from school and then whatever you get from your continuing education, instead of looking at it as like, okay, I'm learning new things, I'm going to let go of the other things that weren't as good or weren't as progressive. It's take it all in, because you may need all of it at, at different points with different people based on listening to their stories. And I think that's a hard thing for a lot of therapists to do. It's certainly a hard thing for young therapists to do because they only have what they learned in school. And I've seen that. And I know when I was a younger therapist, it was very much that way, where it's like you were holding on to the only thing you knew, which was you had no experience. So all you could do is hold on to like what you had just taken a test on. Right.
Right.
So it was, you were very like, very kind of, and you wouldn't let go and you wouldn't be humble enough maybe to understand that like, okay, I'm just going to listen here and I'm not going to like pass on my knowledge to this person in this moment. Right. And I think that that's something that has to come with experience, but it doesn't often, right? Like sometimes it's the opposite, where it's like the more experience you get, the more narrow-minded you get, because you feel like, okay, I've learned, I've seen this in the past and this doesn't work. Now this is the right way. But I actually look at that idea of like trying to find the right way as more of a kind of newbie type of experiment, where when you become more of a veteran, like you should have you could be more flexible. Like you don't have to be necessarily as prepared either. It's just like, okay, like I'll roll with whatever this person is bringing my way, because you have more things in your toolbox. But if you're always narrowing that toolbox to try to find the right way, well, you're not necessarily getting any better. You have a different small tool. You have just a different tool, right? Like you don't have more tools.